At the turn of every new year, many Nigerians make plans known as New Year resolutions, either for themselves, their families, or their businesses. And 2020 was one such year. But barely 2 months into the year, news of a novel coronavirus spreading around the world became a global reality that would soon have consequences for local businesses. The initial reaction wasn't that of extreme fear. Perhaps many easily recall how the nation beat back the deadly Ebola virus few years before. But this was not to be. A months-long lockdown was imposed at the head of strict restrictions by the federal and state governments to reduce the spate of infections as cases mounted. But even as the second wave gets underway, the losses from the first wave, both human and material terms, are yet to be fully accounted for. One such case was Valentine Egbadon, a medical doctor who died in his prime. It was one loss that left his colleagues at the Lagos University Teaching Hospital mourning as they honored him with a candlelight procession. His colleagues described him as good-natured and always willing to lend a helping hand to whoever had a need. Although he was on the front lines, his ultimate dream was to become a world-class surgeon. But there was something even deeper about his passing. It was his personal integrity and the hopes of his aged parents that their only surviving child would make a mark beyond his generation.
He proceeded to the University of Lagos, where he studied medicine and surgery. He also did his housemanship at Lagos State University Teaching Hospital, LUTH.
Dr. Valentine Egbadon was an embodiment of humility, love, and kindness, who lived his life for others.
Laying him to rest wasn't so easy.
I want to believe this will be a clarion call for the government and also even the individuals out there as to safety measures that are to be taken as regards COVID.
I spoke with his distraught mother and heartbroken father, who were both not present at their only child's burial, as it is customary for parents not to bury their children in this part of the world.
I loved him. It's the beautiful thing in my life. It's the beautiful thing that's ever happened to me. I'm going to miss him for the rest of my life.
His father, who couldn't make it to the country due to the pandemic, spoke to us via phone on how much the loss meant to him.
My son is one of the greatest boys you can ever think of. He worked so hard to become a medical doctor. He's a jack of all trades, very lovely young man. I don't know why death took my son so sudden.
Data recently released by Amnesty International shows that about 7,000 health workers around the world have died from COVID-19. In June, a breakdown by the director of the Nigeria Center for Disease Control, that's the NCDC, showed that more than 800 Nigerian health workers contracted the novel coronavirus since the first case was confirmed in February, and that 29 of the health workers worked for the NCDC. The Nigerian Medical Association says slow testing process and a lack of adequate protective gear and testing kits are putting medical workers at risk. Adding that 16 mortality cases have been recorded out of 1,031 cases of doctors who contracted the virus as of October 2020. Health workers on the front lines were not the only ones who were hit by the virus, because for Shebotimo, her mother was only a patient at the General Hospital in Ikorodu, but she was asked to vacate the hospital premises like every other patient so as to avoid contracting the virus at the time. She tells me the family never envisaged the turn of events after leaving the hospital.
But when they said everybody go home, sick or no sick, the instruction is everybody has to go home. COVID-19, they want to avoid spread of COVID-19. And I said, okay, we left.
She says life has not remained the same since her mother passed.
Mom. My mom she's everything to us. Just name it. My mom calls me every day. Not only me, my other siblings too. Every single day. Every morning. Even though when she didn't call. Why would she call? That call, I miss it.
Many Nigerians like Shibotimo lost not just their loved ones to the cold hands of COVID-19. Jobs and businesses too were not spared. Before COVID-19, Nigeria's unemployment rate, according to the National Bureau of Statistics, stood at 23.1% in 2018. And the Minister of Labour and Employment, Chris Ngige, forecast a 33.5% for 2020. This figure, according to experts, has been surpassed with the economic downturn stemming from the pandemic. Vice President Yemi Osinbajo had said the government was anticipating 39.4 million job losses by December of 2020, which means more than 10% of the population will be out of jobs by the end of 2020, based on this projection. For weeks running, I sought to speak with persons who lost their businesses as a result of the pandemic and finally found Marvelous Okoro. Her thriving hospitality and travel agency at the time was badly hit by the pandemic due to the lockdown and closure of the airspace to curb the spread of the virus. Although a second wave has now commenced, the impact from the first wave is not one she'll easily recover from. Hard as I tried, she wouldn't put figures to her loss.
It was badly hit, so it was like my dream of becoming a successful, a more profitable business by the end of 2020 gone with the wind, with the COVID-19 wind. It really impacted my business. I hadn't made any alternative plans. Nobody saw this coming. I didn't see it coming.
In a country like Nigeria, with a population of 200 million people, coping with the coronavirus with a health system that's clearly overstretched and lacking basic tools of work poses a peculiar challenge not just for the personnel on the front lines, but also for the entire populace. Nigeria wrote its name in gold in its handling of the Ebola epidemic. But the question on the lips of many is whether the lessons learned from that successful episode have become gains in the handling of the present challenge. Between the first and second waves of the virus, some common threats could still be found: insufficient community health workers to help with the contact tracing, the undispelled myth around the virus that continues to stick, the need to achieve better social distancing. These are quite the questions that will determine whether Nigeria can make a difference and reduce the losses from the first wave in the second wave.
But there might yet be one more thing to be worried about: vaccines. Hopes of a definitive breakthrough in the production of a vaccine is yet to come through. But it is the hope on which the hopes of a weary world rests. Veronica Danik-Boy, TVC News.
In tackling the coronavirus pandemic, testing and contact tracing remain central, but Nigeria is still struggling to test 1 million persons 9 months after it recorded its first case. Lagos and Oyo states seem to have spent priceless sums in upgrading health facilities to make testing available for residents. Apart from the upgrade of various teaching hospitals across the two states, one testing facility used during the first wave was the drive-through testing center. It's just as simple as it sounds. You drive into the facility and get your test done within minutes, but how accessible and at what cost? In March this year, LifeBank, a healthcare technology and logistics company, launched a first-of-its-kind COVID-19 drive-through mass testing center in Lagos in partnership with the Nigerian Institute of Medical Research and other organizations.
Absolutely, 100% was really effective. It helped us ramp up tests across these two cities and even in Nigeria at large. You know, I mean, about 5% of the tests that was done in Nigeria was from these two centers.
Lagos is yet to publish how much is spent in putting together the testing center. Its neighbor, Oyo, that also worked in partnership with Life Bank, declared that it spent 73 million naira on the drive-through testing center that was located in Adamasingba Stadium. Today, the center no longer exists. The government says it is remodeling the stadium to promote grassroots sports. In Lagos, the epicenter of the virus in Nigeria, figures from laboratories show that more than 20,000 cases had been recorded. John, not my source's real name, tested positive for COVID-19 in Lagos, but had to pay for testing. He was just informed by the health officials.
I felt a private access would be quicker and surer. It was around 40 to 50,000 naira because I was quite down and I wasn't really strong enough to know the process of the whole thing on payment. But I think that was the range of the price.
Further findings reveal that health officials cajole persons seeking to test into using private institutions instead of waiting to be tested at public institutions. This report reveals that testing may not be as simple and available as the government makes it.
Thank you, sir.
Yeah. Welcome.
Yes, sir.
What is there? You attend to 4 at a time.
Okay.
4 I already have 5 cars inside. When to left.
As a matter of fact, to get tested, you might have to know someone on the inside. To get your result, you sometimes have to pay. Indeed, we got an invitation. This is the drive-through testing center in Yaba, Lagos. According to standard procedure, you need to register online at naima.covid.pam.ng. Get an appointment date, then go for testing. If you miss the scheduled time, you can go to the center within a week and still use the same appointment slip. Problem is, you still have to come early because there is shortage of testing materials.
We have run out of materials. We have run out of materials and we're not sure we can attend to you guys. So the person will just come early, very early tomorrow.
If you think that is stressful, health officials seem to have a quicker way. Of course, at a price. We have heard from some persons that you can buy your way through to getting a result. So we wanted to get firsthand how easy it is to get in one. Our reporter makes a phone call to one official at the drive-through testing center. Note, this center is not supposed to test persons traveling outside the country. That's according to the information written at the gate. But our reporter is requesting to have a test conducted for someone traveling at the end of the year.
That you attend, you don't have time to come to the testing center. Somebody has to sit for you so that your data will enter the STD of that system. Without that, it's fake. So those are the things that I have already arranged. Send the details to one of our sisters. So that I will not make mistakes when they ask questions.
So if somebody is going to sit for me, how much is that one?
I send the price for you. I say that it's okay. I say, okay, pay 35.
35,000 naira is what our reporter was asked to pay. But then our reporter probed further, asking if the result is authentic.
I don't have any problem. You have my number. Our office is number 1 office in the property country is concerned. You don't have any. You are working with the senior doctor. It's not something that you have. You don't have any problem. People have been doing this COVID-19 that we are being on the system today. The COVID-19 will finish. So you don't have any cause for that. People, even for the other countries, people are sending their people to me. This is what many people are. You don't have any problem.
After days of negotiation, the first official links our reporter to a senior doctor who is in charge of imputing the biodata.
If you are the friend needed, you should contact me.
Okay. No problem. At the same price.
I should put 5,000 if it's coming, unless you come to the testing center.
Okay.
If he's coming to the testing center, we can collect 30. But if it is, it's risky.
Yes.
Somebody is sitting for you now.
I understand.
Someone is sitting for you.
Investigations reveal that the results are shadowed, so it appears you conducted a test in the last 72 hours before your departure date. What this simply means is that you can actually sit in the comfort of your home and just get a COVID-19 test result to present at the airport. While the nation currently battles a second wave of the pandemic, with an obvious apathy for adhering to safety protocols, attitudes like this put the gains of the last few months in limbo, causing people to think the virus is a hoax. Either way, it just simply shows there is a little problem with Nigeria's COVID-19 testing system, with accountability and transparency lacking in many quarters.